Welcome back, students. Let's continue with the different routes of vaccination. We had mentioned earlier about the oral as well as the intranasal routes, and so now let's go to the next routes that we have, that is the intradermal, subcutaneous as well as the intramuscular routes. Before we go into the deep of this, we need to know the skin anatomy and the skin layer thickness to know through which we have to inject a vaccine and what are the significances of it. So let's go into it. The skin anatomy first. If you go to look at the skin, you can see that it mainly consists of three main layers. One is the epidermis, which is the outermost layer, followed by that is a underlying dermis, and then you have a hypodermis. And below the hypodermis, you have the muscle layer. And as the term implies, intradermal layer means you will inject into the dermal layer. That is, you will pierce through this epidermis, you will pierce through the epidermis, and you will not go beyond down to the hypodermis or to the muscle layer. So usually the injection has been given in such a way that you will give a parallel pierce onto the epidermal layer, so that the vaccine components have been coming to the dermal layer. Now, rather than giving through parallel layers, if you give through an ankle like this, and if it goes little more deeper, it might reach this layer called the hypodermis, or it is a cutaneous layer. So this, when it reaches here, you call it as a subcutaneous injection. Now, if you want to inject in such a way that it reaches your muscle, so you must imagine a thing. If when you do it parallel, it reaches here. When you do in almost 45-degree, it reaches the hypodermis, and then once it goes through a 90-degree angle towards the bottom in a deep sort of way, that will reach the muscle. So there are three main ways by which you can inject a vaccine on your skin. One is the intradermal layer. The second one is the subcutaneous layer. You just remember, this is a cutaneous layer that you have. So you have a subcutaneous type of injection as well as an intramuscular injection. So let's go into the details of that. The skin layer, as we told earlier, it is around 0.2 millimeter thick, and it has a outer epidermis, and then below the epidermis lies the dermis, ranges of about 1.5 to 3 millimeter thick. And below the dermis, there is a subcutaneous fatty tissue called the hypodermis, and the thickness of that will vary depending upon different people, as well as their age and all that. It will vary. And if you're trying to inject, I had mentioned this earlier, in a too shallow injection through the epidermis would result in the formation of the epidermal type of infection, and intradermal, and a wrong angle and deeper material would end up as a subcutaneous injection, and a deeper still, and in rare cases depending on the age, weight and size, it could even end up in an intramuscular type of injection. Now these are the different angles which I had mentioned to you earlier. If you go deep down at 90-degree down, you will reach the muscle, and if you go it almost parallel, that is maximum of about 15-degree angle, you will go to the dermal layer, and that is an intradermal mode of infection. But if you put the injection needle at a 45-degree angle, but not that deep, it will result in the formation of a subcutaneous type of injection. Now let's talk about the intradermal injections. Intradermal injections, it administers a vaccine in the topmost layer of the skin, and BCG is the only vaccine which we use this route of administration, and it reduces the use of ID infection, will reduce the risk of neurovascular injury when we use BCG vaccine. But health workers also do say that when you have to give a BCG vaccine for a small kid or a newborn arm, it is quite not easy, and you can see that you don't need to go deep down. So what happens, a short narrow needle is just sufficient for the BCG vaccine. A 50 mm 26 gauge vaccine is sufficient, but for the other vaccinations you give longer and wider needles. That is, see the length difference itself. For subcutaneous and intramuscular injections, what happens? You need to have a longer needle, which has been found to be wider also. And here intradermal, it is a bit painful and it requires only a small amount of drug, because if you put more amount of drug, it would even come out. And the procedure of intradermal infection: for ID injection, the needle is inserted into the skin at an angle parallel to the surface, typically the volar surface of the forearm or the deltoid surface of the upper arm is used. And usually a short bevel, a fine gauge needle with about 27 gauge is used, and the bevel is up when inserted and the needle goes into around approximately of about 5 to 15 degree angle into the slightly stretched skin, and the entire bevel of the needle should penetrate into the skin. And once the bevel penetrates the skin all the way through 3 millimeters in, the material is injected, causing a bleb or veil to form as the injected fluid stretches the epidermis and its basement membrane above the injection site. Now, if the material leaks onto the skin, penetration was too shallow, and if the bleb doesn't form, the penetration was too deep and the material has ended up to the subcutaneous layer. So, the bleb indicates whether an injection went into the intradermal layer rather than the subcutaneous layer. So, you might think, what is a bleb? See, this is a bleb. Okay, if the bleb is not coming, it indicates that it has gone down into the subcutaneous layer. And if you think that there is a lot of material which is coming out, if the injection is fully, rather than forming a bleb, if a large amount of the injection is being piercing out from the skin or it's overflowing, it indicates that the poke that you are given on the skin is being found to be too shallow, and the intradermal layer, it is not entered into the intradermal layer. So, it's between, that is, a bleb level is fine, okay, but if the bleb doesn't come, it indicates that it has got subcutaneous, and if it is more than a bleb, it indicates that it is not gone to the intradermal layer. So we have to we have to be careful of that, and this can only be carried out by trained personnel. Now come to the next one, called the intramuscular injection. Here you administer the vaccine into the muscle mass, and the vaccines containing adjuvants should be injected intramuscularly to reduce the adverse local effect. You know what is an adjuvant? An adjuvant is a substance to increase the immunogenicity of the vaccine. Now, intramuscular vaccines, they are other types of deliveries. They have been done when other type of delivery systems are not recommended. Now, you could remember that intramuscular vaccination that we give is normally in the case of TT, tetanus, okay, and intramuscular injections may be used instead of intravenous injections, because some drugs are irritating to the veins, or because a suitable vein can't be located. And it may be used instead of oral delivery, because some drugs are destroyed by the digestive system when a drug is swallowed. So, two different options. When the two different options are being not available, we use an intramuscular injection. What are the two different options that we have? That is the either through the oral route or through the intravenous route. So, if a drug is being degraded by by the oral digestive system, then you cannot use it orally. Or if you put it injected through your veins, what happens? That is intravenous. If such drugs are being, or those vaccines when injected intravenously, if they are being destroyed, you cannot, or they are destroyed, or if they are even irritating to your veins, what happens? You cannot give them intravenously or venously. So, in either of these two conditions, you mainly pass them through the intramuscular route. Now, intramuscular route of injection has some advantages. It has been found that the injections which have been given through IM are absorbed faster than subcutaneous injections as well as oral routes, and this is mainly because the muscle tissue had a greater blood supply than the tissues under the skin. Okay, so the better absorption is being done through the intramuscular route, and the muscle tissue can also hold a larger volume of medication than the subcutaneous tissue. And a mild irritant and the depot injection and soluble substances and suspensions can also be given by these route, as we had mentioned earlier. Like some of them might be irritant to the intravenous route. Now you have some disadvantages here. You expect an aseptic condition to do the IM injection. It could be painful sometimes, and also injury to the nerve. Sometimes it might be ineffective also in some cases. So these are the intramuscular injections. Now you might think, which muscles? You can use either the deltoid muscle of the arm. This is the deltoid muscle which has been shown here. It's the site most typically used for vaccines, but it is not a site for self injection, because small muscle limits the volume of medication that can be injected, and it is only maximum not more than 1 ml can be injected into the deltoid muscle. Then you have the vastus lateralis. Now what is the vastus lateralis? Of course, it's quite evident here in this figure. It's in your thigh. In your thigh, you mainly divide it into 3 different regions, and then in the middle portion of these 3 sections, you inject the vaccine. Then you have the dorsogluteal muscle, or of the buttocks. Okay, the buttocks muscle. Okay. It is the most common site of healthcare workers for many years, but due to the potential for injury to the sciatic nerve, the ventrogluteal muscle is also being used. You have, see, in the dorsogluteal muscle, you are having a sciatic nerve here. So there are some chances by which you might give, the chances are there that this nerve might get injured. So that you will use a ventrogluteal site also for the injection. I hope these muscles are clear to you. Now ventrogluteal muscles, these are the safest site of injection for adults as well as children older than 7 months, and it's deep and not close to any blood vessel and nerves, and the site is difficult for self injection and may require the help of a friend, family member or a caregiver. So we will be continuing with the subcutaneous mode of injection in the next session. Hope so this is clear to you. Thank you.